Our son had two very serious heart defects. One is called hypoplastic left heart syndrome. That's basically when the left ventricle does not form. And so the child is missing one of the four chambers of the heart, and it's 100% fatal unless you do something about it. Heart transplant is one possibility, but it's very hard to get baby hearts. And so the other possibility is 3-stage surgeries, which we chose. But he also had a second defect when the hole between the top two chambers of his heart was closed. It's supposed to be open. And because that was closed, that was causing blood to push back into his lungs, which would make him very sick upon birth.
It was us trying to find out which hospitals, because as Jody delved into it, it was finding out that not every hospital had the facilities to deal with these issues.
Joshua, do you want anything to eat, honey?
We asked our cardiologist, we said, where would you take your child? And she worked for the local hospital, but she said, honestly, she trained at Children's Hospital of Philadelphia, and she said one of the best surgeons in the nation, if not in the world, for single ventricle defects is at that hospital, and I would highly recommend that you look into that. Children's Hospital called us and let us know that the hospital was in our insurance network, but the doctors weren't, and this was going to be a problem. So we asked them, well, what do we need to do? They said, well, call your insurance company and find out what you need to do. And we called Anthem, and Anthem said, get a letter of necessity from your cardiologist explaining why you have to go to Children's Hospital of Philadelphia when you live in Richmond, Virginia, versus going to the local hospital. So our cardiologist wrote that letter for us. It was a good letter, and I also wrote a letter to Anthem. And they took those letters, and we got a letter back from them saying that we should not have to worry about our health care at this stressful time. We thought, okay, we know what to expect. It's going to be like it's always been, where we pay 20% up to $3,000. What ended up happening is instead of the 20% of the bills and then a cap, we paid 20% of what the insurance decided was reasonable and customary. And so they said, okay, we'll pay 80% as if it were a network of the $1,000. The problem is the bill is $2,000. So what we got stuck with was the extra $1,000 plus the $200 that would be our 20%.
When you're at the hospital and the doctor says we need to do this, take pictures of his lungs, you didn't think about it. The doctor's saying you need to do it. And then when you get home and there's the EOB, the explanation of benefits, and they're sitting there and it's telling you, well, that the doctor charges, I don't know, $700 for this thing, and they're doing it every day, and we're paying a small part of that. It's not one of the things that you sit there and you should say to yourself, well, geez, what was I going to do? Tell the doctor, no, sorry, you got to hold off a couple days because we can't afford this every day? I mean, it's not something that you think about until after the fact. I mean, but even so, I mean, it wasn't, even if we had known, we couldn't have, I would have never said, no, I can't do that.
Well, no parent should have to make a choice when there's a life and death situation with a child. And our choice was we save our child and we go into major debt, or we let our child die. And we know that he wouldn't have lived if he had stayed here and had surgery here, or even in the hospital that's not too far away from us. And that's just not something we should have to face. But we also know we would have done it all over again.
We paid for insurance. We're not asking somebody to provide us for free medical care. We paid for insurance, and the insurance company wasn't there to make sure that it was all taken care of. It wasn't there. I mean, I'm 41 years old, and this is the first time I've really needed insurance, and it failed me.